Good evening everyone. Welcome guys. Let's come for Makeup Day Series 1. Today I have given 65 tests. In that 65 test, we will be getting 1 mark sure for FMGE and 1 mark for the NEET PG. But we are mainly concentrating on FMGE SURE shots. Let's discuss about few tests and why we are for which test, which disease. Okay. Adam test. Adam test is for scoliosis. So here is a mnemonics. What is the mnemonics? Adam apple stands straight, but Adam bends. Adam's apple, it's in the thyroid gland, stands straight, but Adam, consider Adam a person. Adam bends. So Adam a person bends. Usually our bending structure, we can see that scoliosis. Comes for second, Allen test. Allen test is for ABG analysis. Aldegate test. Aldegate is for ancient disease. Aldegate for ancient disease. It's a mnemonic. Aldegate test, leprosy. Ancient disease. So number 4, Paspec test. It is used to test the effectiveness of the pasteurization. So it's for pasteurization. So there will be a mnemonic also. Paspec is to check for pasteurization fate. Pasteurization fate. Patch test. Patch test is for allergic reaction. Tourniquet test. Dengue. Here is a mnemonic I can give you. Tourniquet titans for dengue bite. Tourniquet titans for dengue bite. Then let's come for urea breath test. Urea breath test is for pylori infection, H. pylori infection detects. It was the detection of H. pylori infection. H. pylori Sheehy test. It's for diphtheria. It's test immunity to diphtheria. Dick test is for scarlet fever. Dick test for scarlet. That's a mnemonic. Scarlet. Dick test is for scarlet fever. So Rothera's test. Rothera's test. Come on, bacho. Acetone in the urine. The mnemonic will be like Rothera for keto in urine. Ketones. Detects the ketones in the urine. Rothera will be detecting ketone in the urine. Detecting ketones in the urine. So detects the acetone in urine. ACE test. ACE test is for bile salt in the urine. ACE test is for detecting bile salts in the urine. Smith's test detects the bile pigments in urine. So bile salt is for hay. Salt is for hay. Haze. You can see the haze. Smith is for detecting bile pigments. So Smith test is for detecting bile pigments in urine. Right, bachao? Benedict test. So people definitely know this Benedict test. Benedict sweet urine test. It's for urine glucose test. Benedict test is for urine glucose test. K-Weem test. K-Weem test. K-Weem test is for, it's a skin test for sarcoidosis. K-Weem test is for skin test for sarcoidosis. Rene and Weber test. Definitely people knows. It's for the hearing. Hearing test. So test for hearing loss and ear conduction. So here comes this direct Coombs test. Most of the times it's like a QQQ. Very, very important. Direct Coombs test. From this topic, every year, every year we have 2 FMG examinations. Every year, either in the first set or the second set, in the supplementary sheets, there will be one question. We'll discuss briefly about direct Coombs test by tomorrow. Direct Coombs test is for hemolytic anemia, detects the antibodies which causes the hemolysis in our body. So technically it's hemolytic anemia. So the mnemonic will be like, Coombs is like a police officer. Consider he is like a police officer. He is catching the culprit in anemia. The culprit is antibiotic. The culprit is antibodies. But the culprit will be catched by Coombs. The mnemonics will be Coombs catches the culprit. Istera test is for color vision. Test for color blindness people. Test for color blindness people. Snellen chart test. It's for measures the distance vision test, 6/36, like that. Snellen chart is for distance vision measuring one. Confrontation test. It's for visual field testing. Confrontation test is like visual field test. So confrontation test will be central and peripheral vision, both of the vision, central and peripheral vision. Not a both, it's a central and peripheral vision. Jagger's type code test. Jagger's type code test. So what is the Jagger's type code test? Let's see, expecting 2024 December. Jagger's type code test, which is used for testing the near vision. Okay. near vision. So Schilling test, vitamin B12 absorption, which helps to the Schilling test is helping to determine the B12 absorption. Determines B12 absorption. Histamine test, it's for leprosy, identifies the leprosy reaction. Histamine test is for identifying leprosy reaction. Rollover test, it's for preeclampsia. It is usually for detecting preeclampsia in pregnancy. Let's write it down. Detects preeclampsia in pregnancy. Fen or nitrazilin test. Now this is most common word I was hearing in this years. I think so. This was a PYQ, July 6. Fen or nitrazine test. It's for test of the leakage of amniotic fluid. There will be a mnemonic. Fen leaves, amniotic leaks. Here is the mnemonic. Fen leaves, amniotic leaks. So that's the mnemonic. Fen is for detecting the test for leakage of amniotic fluid. Test for leakage of amniotic fluid. VD oral test. VD oral test, most common one. Test for syphilis. VMA, vinyl mandelic acid test. Test for pheochromocytoma. Test for pheochromocytoma. Where we can see test for in the adrenal tumor. Pheocytochroma in adrenal tumor. Adrenal tumor. Glucose tolerance test. Its diagnosis the diabetes. So it's GTT is diabetes mellitus type 2. GTT. So HbA1c is also for diabetes mellitus testing type 2 only, but there is a thing which is used to track the long term measure in HbA1c. The function, what is difference between the GTT and HbA1c? GTT is like, within few seconds or like by 1 or 2 hours, every 4 hours we used to take in the patient which we are in the ICU or emergency ward. You may be in the ER, dirty patients we used to take it. But HbA1c, it's like it tracks the long-term sugar from the patient. Measures the long-term glucose control in our body. Water deprivation test. Diabetes insipidus. Diabetes insipidus type 1 or type 1. This is a diabetes mellitus, or also known as type 2, and diabetes insipidus also known as the type 1. Treadmill test, lot of people know. Heart function, cardiac. Okay, it's a cardiac heart function test. Now, why we are doing this? Assessing the heart under stress. Triple test. Triple test is for trisomy. Triple check for trisomy. Down syndrome. Down's syndrome. So the mnemonic will be triple check for trisomy. D-dimer test. Clot formation. Indicates the clotting disorders, the main three Qs. Okay, clot formation. It helps to detect the clot disorders. Indicates the clotting disorders. Indicating the indicating the clotting disorders, especially in the places deep vein thrombosis, P and DIC. Okay, come on, let's go to next. Trendelenburg test. It's for varicose vein. Test for varicose vein. Varicose vein. Palin and Tenial test. Once again, let's discuss about D-dimer test. It's for the clot formation. Palin and Tenial test. Carpal tunnel syndrome. Detects the. It helps to detect the carpal tunnel syndrome. Gold quantiferon test detects the latent tuberculosis. Gold mnemonic will be gold for TB. So you can directly gold for TB, directly go for latent, detecting the latent TB, tuberculosis. Bangle test, protein energy malnutrition. Bangle test is for like assessing malnutrition in the children. Penicillin test, diagnosis myasthenia gravis. Romberg test, test for the balancing and proportion. It's for the, like, balancing gait, balancing our body and balancing our gait or our body. It's like a neurological function. So Romberg test is for neurological function. Kering's test indicates meningitis. Kerning curls for meningitis. That's for Kering's curls for meningitis. That's a mnemonic. Indicates meningitis. T-Zac test identifies herpes or varus zoster, herpes simplex or varicella. T-Zac it's like for tiny blisters, no? Tiny blisters. So identifies herpes simplex or varicella viruses. Identifies herpes simplex or varicella. Frey's test, FREI test, detects a lymphogranuloma bernum. Detects, see guys, see bacho, I will say the mnemonics later. Detects lymphogranuloma venereum. The mnemonic will like FREI finds the lump. So the FREI is finding the lump. Viral test is for typhoid fever. PSM के most important question बच्चों. Whale Felix test detects the rickettsial infections. What are the rickettsial infections? It's a typhus. So detects. What is Felix test is for? Rickettsial infections. What is the infection, bacho? Typhus. Bony test. Bony test is for stress incontinence. It's a Bonis bladder. Bonis bladder. It's for stress incontinence. Wait, bacho. Continence. Okay. Let's go for the next. Binet test. Binet test is for measuring our intelligence of our brain. B for B. So B for B, remember, B for brain. It's like, brain power checkup. So brain power checking. So brain power checking will be like, what is the brain power checking? Binet's brain power, measuring the intelligence of our brain. Intelligence Binet. Intelligence quotient. Sweat chloride test or sweet chloride test. We used to say sweet chloride test. Sweety salty for cystic. Sweety salty for cystic. Chloride is like a taste of salt. That's why sweet is for sugar. So sweety salty for cystic fibrosis. Hanging drop test detects the Vibrio chloride. Detecting Vibrio chloride. Hanging drop test. It's one of your PYQ guys. Remember. Is to detect Vibrio chloride. Paul Bennell test. Paul Bunnell for EBV. No, Epstein-Barr virus detects in the infectious mononucleus. Epstein-Barr virus is no, it's a mononucleosis. Epstein-Barr virus, it's a mononucleosis. Shake test or bubble test, assessing the fetal lung maturity. Shake is for check the lungs. Assessing fetal lung maturity. It's for assessing. Rubin test, fallopian tube patency. Checks the Rubin's test is for checking the patency of fallopian tube. Okay. Checking patency of fallopian tubes. Next is tape test. Tape test is detects a pinworm infestation. Tape traps the worm. That's a mnemonic. Maybe you can get for a good mnemonic. Next time I will try for a good mnemonic, guys. Tape test. It's for detecting pinworm infestation. Pinworm infestation. Orthotolidine test. Orthotolidine test is for checking the water chlorine. Tolidine, remember this tolidine. Some of our homes will be having RO water clinics. This tolidine is there. The tolidine, the water chlorine content, which is for checking. So checks the chlorine level in the water. It's usually the orthotolidine test is for checking chlorine levels in the water. CHLO. Chlorine levels in urine. Levels in water, guys. Awake bacho, no sleep. We will clear this exam for sure, huh? DEXA scan is for bone metabolism. DEXA digs into bones, that's it. Measuring bone mineral density to diagnosis osteoporosis or other disorders. DEXA scan is for checking is there any for bone metabolic diseases. So bone metabolic diseases. So what are the diseases we can expect in the, for example, just to say there is a bone mineral density to diagnose osteoporosis. That's it, bacho. Heel to shin test. It's a neurological examination. Lower limb coordination neurological examination. Coordination neurological examination. Let me write it fully for you guys. Lower limb coordination neurological examination. Okay. It's all about body coordination. Halo test. Halo test is for CFF leakage detecting. So Halo test is for detecting CSF leakage. Dexamethasone suppression test. It's for diagnosing Cushing syndrome by assessing the adrenal gland function. Now let me write it here. The key features is like used to diagnose the Cushing syndrome. So diagnosing Cushing syndrome by assessing adrenal function. Assessing adrenal function. So it's for like ACTH or pituitary or adrenal gland tumor. It's like checking the tumor simply. Dexamethasone suppression test is for ACTH or pituitary or adrenal gland tumor. Adrenal gland tumor. Arthrosynthesis. Arthrosynthesis. Artho. You can see arthro. I'm saying arthro. It comes the same meaning, na? So artho people will be looking for mostly the joints. So joints is for like arthritis. So commonly the infections in the in the joint. So joint inflammation and the infection. Joint inflammation and infection. Holter monitoring. Holter monitoring is for ECG bacho. 24 hours ECG monitoring for arrhythmias. It's like continuously monitoring the ECG. Holter's monitoring. Continuous monitoring. Wait bacho. Of ECG. So we commonly mention as 24-hour ECG monitoring machine for arrhythmia. For irregular heartbeats. Pulmonary function test, spirometry, measuring the lung volume and capacity. Measuring lung volume and capacity. It's done by spirometer. The spirometer. In our olden days, we used a spirometer. The spirometer will be like it's our Sangha. Brahma Sango. SGPT, SGLT, SGOT, ALT, AST is for liver enzymes, liver function test. LFT. Liver function test. Pap smear. It's for screening, guys. It's for the screening test for cervical cancer. If there is any cancer or not, that we are checking over there in the pap smear. Screening for cervical cancer. Okay, now you got bacho. We are almost near to the end bacho. Keep it up, keep it up. Creatinine clearance test. It's for assessing our kidney function. Creatinine clearance test is for assessing the kidney function, which aims to estimate the GFR level, glomerular filtration rate, GFR levels. Helps to assess or estimates the GFR levels. Wood's light examination. It's for the skin infections, using the UV light to detect the fungal and bacterial infections. UV and Wood's light examination is for using the UV light to detect the fungal and bacterial infection. UV rays. Now detect for bacterial or fungal infections. Okay, got it, bacho, got it. So this detecting feature will be is there in the in the superficial of the skin infections. Wood light shines on the skin sins. Whenever we are passing the wood light during the places where we are seeing the skin sins, it shines brighter. We can see the brighter. That's why we call it as wood light examination. Superficial skin infections. Okay, bacha, got it. Burrow ink test. So what is burrow ink test? It's used for scabies, for itching purposes. Okay, burrow ink test is scabies, the itch. Last but not least, brothers and sisters, Braden scale. Braden scale. Braden scale is for assessing our bed sore risk. It's for staging of the bed sores. For bed sores. Assesses bed sore risk. Okay, we completed, bacho. Let's discuss one quick recap. 5 minutes. Just only the test and names. Okay, let me go from down. Braden scale, assess the bed sore risk. Burrow ink test, scabies. Wood light examination, superficial skin infections. Creatinine clearance test, GFR levels. Pap smear for cervical cancer. SGPT, SGOT, AST, ALT, liver function test. PFT spirometer. Holter monitoring, 24 hours of ECG monitor for arrhythmias. Arthrocentritis, joint inflammation and infection. Dexamethasone suppression test is for Cushing syndrome diagnosis. Adrenal gland tumor and pituitary ACTH. I'm marking it as a dexamethasone suppression test. Halo test is for CSF leakage. Heel to shin test is for body coordination, neurological examination. DEXA scan, bone metabolic disease. Either we can find it out as osteoporosis or there any. Orthotouridine test, touridine. I said touridine, guys, it's for water. Touridine, checking chlorine levels in the water. Tape test. Tape test is for, guys, I'm repeating once again, triple Q. tape test is for detecting pinworm infestation. Even the tape test is for detecting pinworm infestation. Rubin's test. We forget about the Rubin test properly, right? See, Rubin fallopian tube. Here comes the mnemonic. Rub for Rubian. Rub for fallopian tube. Rubin for fallopian tube patency test. It's for patency. Shake test. Assessing the fetal lung maturity. Paul-Bennell test. Epstein-Barr virus. Epstein-Barr virus is a mononucleosis. Anglin drop test detects the Vibrio chloride. Anglin drop test is for detecting the Vibrio chloride. Sweet chloride test. Sugar salt cystic fibrosis. Understand, bacho? Sugar salt cystic fibrosis. Binet test. Beef B. BB. Binet B. BI. This I will be saying about your intelligence. Intelligence quotient. Bony's test. Bony for bladder stress incontinence. Bale Felix test detects a rickettsial infection. Typhus. Viral test. Viral test bacho most common in PSM. Viral test is for typhoid fever. FREI test finds the lump. FREI finds the lump. So it will be like detects a lymphogranuloma verum. Detects a lymphogranuloma varium. T-Jank test. Identifying the herpes simplex or varicella. This is for thin blisters. Kernick test indicators are meningitis. Okay, Kernings for Kernings. Kernings is considered as a curls for meningitis. Romberg test. Romberg test is for also a neurological function. Romberg test is for neurological function. Okay. Tensilin test. Diagnosis of myasthenia gravis. Tensilin test is for myasthenia gravis. MG. TTMG. Madan Gori. It's like tensilin test is like giving a hard stress levels to Madan Gori. Indirectly we were mentioning it as like a myasthenia gravis. Bangle test. Protein energy malnutrition. Whenever we are taking a bangle and put it in the children and sometimes it won't go, sometimes it will go till the shoulder level, so they will be like protein emergency deficiency. This bangle test is for PSM. Important bacho. It's a PYQ also. Gold for TB. I already mentioned gold quantiferon test. Gold for TB. Palin and Tenial sign. Palin and Tenial sign is like carpal tunnel syndrome, detecting the carpal tunnel syndrome. Tallenberg test. Tallenberg test is for varicose veins. D-dimer test. Triple Q, I marked as a triple Q. That means we can expect clot formation. DVT, PE and DIC. These are the three names. Triple test. Triple test is for checking trisomy. Trisomy is like Down syndrome. Another name of trisomy is either a Down syndrome or Klinefelter syndrome. Let's discuss later about it. Treadmill stress test. So we are giving stress to cardiac and heart function. The stress level, treadmill or stress test, the patient is running in the treadmill. We are giving some of the stress test. How come the patient, how many levels the patient is managing. That was we are saying cardiac or heart function. Water depurification test. Diabetic insipidus. Water depurification test. Diabetes insipidus. HbA1c is for type 2. GTT is for type 2. VMA, vanil mandelic acid, piocytochroma, test for adrenal tumor. VDRL test is for syphilis. Lot of people are marking as malaria. VDRL test for syphilis. Fern nitrazine test. Fern leaves, amniotic fluid leaks. That was our mnemonic. Fern leaves, amniotic fluid leaks. Rollover test detects preeclampsia in pregnancy. Rollover test detecting the preeclampsia in pregnancy. Histamine test identifying the leprosy reaction. Histamine is for histamine test identifying the leprosy reaction. Schilling test deformity, vitamin B12 absorption, vitamin B12 absorption. Okay. Jaggers type card test, Jaggers type card test for near vision. Jaggers type card test, near vision. Confrontation test is for the visual field test, central and peripheral vision. Snellen and chart test, distance vision. Snellen and chart is for distant vision. Jaggers type test is for the nearer vision. Ischera test, rest for odor blindness pull. So people those who are blind or the color blindness, technically they will see the red and they will say orange or black. Definitely they will say black. And then the confrontation test, visual field test. Okay. Snellen chart is for the distance vision, Hysteria color vision. Direct Coombs test. Coombe is like acting as a police officer. Coombe catches the culprit. And hemolytic anemia. Rennie and Webster's test. It's for the hearing losses or the ear conduction. K-vein test, skin test for the sarcoidosis. Benedict test, it's for the urine glucose. Smith test, detect the bile pigment. Smith pigment, detecting bile pigment in the urine. HAS test, detecting the bile salts in your weight. Rothera's test, Rothera's acetone in the urine. Dick test, scarlet fever. Sahik test, diphtheria. Urea breath test, H. pylori. Tourniquet test and patch test, allergic reaction. Passport test, pasteurization. Passport is testing is for pasteurization, PYQ. Aldehyde test, leprosy in the Indian days. Allen test, ABG analysis. Adam test, Adam's apple, Adam bend is the scoliosis. Okay, thank you guys. Let me discuss about their uses and where to use, where not to use by tomorrow's session or another day session. Let's revise and mark up this.